Hi, I'm April Wilkner, and I am a 988 crisis counselor.
Hi, I'm Lucia Wiedemann, and I'm a 988 crisis counselor.
I'm Gabriela Torres, and I'm a 988 crisis counselor. A typical day in the office is remote. I am a training supervisor, so I interview and recruit new volunteers. We have 2-month training cycles, so we're teaching them how to take these calls for 2 months at a time. And then they go into a 12-week apprenticeship period where they're working on the lines but under a lot of supervision. So we're kind of leading those training classes and then transitioning them onto the lines, and then that cycle starts over. I also have continued to take calls, so I take 1 shift a week where I am myself working on the lines, talking to people who are experiencing suicidal crisis, and it's been a great role. It really changes every day, and it's all about connecting with people.
I think the biggest misconception that people have about what we do as 988 crisis counselors is that we're some kind of a stepping stone to a police intervention. That is, in my experience, very little of what we do on the line. We're really more there to just listen to a person without trying to fix them and to give them a space to speak honestly about how they're feeling.
Another misconception that I feel like a lot of folks have is that they think that we are paid. While there are paid positions like bilingual counselors and follow-up counselors, the majority of the volunteer counselors, we are not paid. We volunteer our free time to do this, to do the training, to do our shifts, and this is all purely because we want to do this for one reason or another, for whether it's a personal reason or we've been affected by suicide in some way, or we feel like we want to help and reach out to those around us.
Your job has always been tough, and in the last couple of years, it's been even tougher. Life may seem difficult to manage at times with all that you do at your call centers and in your homes. Often, we forget that we need to take care of ourselves to better serve others and be there for them. However, we also need to tend to ourselves. We know that you've probably heard some of what we're going to talk about in today's video. But it's important that we first start with a quick review. We want you to know that your work doesn't go unnoticed, and you matter just as much as those you serve. We sometimes don't realize how much our work experience can affect us.
With recent life events such as the pandemic, increased violence, and community uncertainties, dispatchers are under a lot of pressure and stress, frequently wondering if they had enough training to handle the next crisis or call. As we all know, every call is different from the other. Often first responders question if they have peer and organizational support when they're undergoing these stressful conditions. It is often reported that the culture of first responders is still very much the culture of just suck it up. But at what cost? The cost of caring without protective factors and interventions can lead to burnout and or vicarious trauma. What is vicarious trauma? It's emotional residue of exposure from working with people, and one hears trauma stories and becomes witness to the pain, fear, and terror that trauma survivors have endured. When you experience chronic stress or vicarious trauma, everyone can respond very differently. What does this look like? These symptoms can impact all parts of your life, cognitively, socially, emotionally, and physically. It's important to note that these effects and responses of vicarious trauma can be seen to play out differently from person to person. Cognitively, you can experience intrusive thoughts about the traumatic event. It can affect your ability to think rationally and critically. Socially, you can procrastinate, withdraw from responsibilities. You can isolate from others. You can lose the desire to collaborate, have difficulty trusting others, and at work or your personal lives. Emotionally, you may experience fatigue, feelings of helplessness, loss of self-confidence, diminished joy. Defeated, you may feel loss of motivation. Physically, You may feel tired, drained, irritable, disconnected. You might even experience body aches, pains. You may have trouble sleeping and may have even loss of desires. You're exhausted at the end of the day.
What is resiliency? Let's think about that. Resilience is very important, and it's not something that we were born with. We actually work towards it. It can be by the support that you receive in the community, your family, and your friends. Resiliency helps you deal with a lot of stressors that might come in your life. And it's very important to address those stressors, and we do that by building our resiliency. Studies have shown that resiliency is very important when taking care of burnout or vicarious trauma. By building resiliency, you are able to cope with the daily stressors and challenges that people might face. Resiliency is also a very personal choice. It can work in different ways. For example, what makes you happy? What is your comfort zone? This is how we can build on our resiliency. And sometimes we'll feel resilient and other days we don't, and that's okay. Let's talk about how important boundaries are. Boundaries is something that we need to establish at work and within our family and our friends. Boundaries are important to understand the way people should treat you and not treat you. Boundaries are important at work and at home. It is important to establish those boundaries in order for you to feel better and to deal with the daily stressors. Emotional regulation is important when dealing with your feelings. There are 4 domains of self-care. These 4 domains are the following.
The organization that I work for, Dee Hirsch, is actually doing a lot to help mitigate vicarious trauma and burnout. I think one of the main things that they do for us as crisis counselors is they allow room for a sense of lightness and a sense of humor in the virtual space that we all share. Of course, that's not when we are actually counseling someone on 988, but when we're dipping out, when we have our 10-minute breaks, there's actually a lot of laughter that goes on our group chains. There's a lot of gifts, there's a lot of jokes. We even have pet talent contests and movie trivia night. So it keeps you light like a boxer. So you can go back into the ring and you're flexible, you're loose, you've had that release, sometimes even a good laugh. The way that I practice self-care is very much a product of how I was brought up by my Japanese mother, and she believed that there was no problem that a steaming bowl of noodle soup could not solve. Everything I tell my supervisors at the end of shift about self-care has some form of dumplings, udon, ramen. Yeah, I'm a big, I'm an emotional eater, I guess I would have to admit.
Self-care is incredibly important for someone in a role like mine, and it's something I've had to become very intentional about practicing. I feel like knowing what your non-negotiables are is super important. I love to be outside and I love to be active, so some of the things that I do to make sure I'm taking care of myself is going for runs and going for hikes. I also think debriefing with other people who work on the lines, making sure you have some connections in that space where you can really speak openly about the hard things that you might be talking about on a day-to-day is super important.
I practice self-care. I practice it on my own in terms of I like to crochet on my free time. After my shift, sometimes I'll paint something. But also I really love to relish in my time with my family. So after my shift, I'll have a nice dinner with them. I'll talk to them, not necessarily about what happened on the shift, but say, yeah, it was a hard day and I just need to decompress, or I'll watch a movie. And I just really like to spend quality time because it kind of gets me out of my head and lets me decompress in my own way. I need to be kinder to myself a lot of the time because I'm kind to all the people I help on the shift. So why can't I do that for me?
I think the skills that I was taught as a 988 crisis counselor helped me tremendously in my personal life. They helped me be a better listener to my friends, but they also help me in how I talk to myself when I'm having my own moment of struggle. It sounds a little weird, but if I am having a moment, I will sort of walk myself through the things that I walk someone who calls in on the hotline through, and do the same safety checks with myself. So it's effective to use on your loved ones as well as yourself.
While a lot of the calls that we get are relatively low risk and we're just sort of connecting with a person, there are occasionally those really high risk moments where you can tell that someone is really serious. And some calls that have stuck with me over the years, in particular, are these high risk calls. I think one in particular, I had a caller who reached out in the middle of a panic attack and with a loaded gun in hand. And I could hear it. I could hear the gun. You can hear that weight being set on a table. It's a weird thing to be able to recognize the sound of, but we pretty much know when someone is serious. And when I first picked up, it was such a moment of panic, and I think had I been a less experienced counselor on the line, I would have been incredibly stressed. But we were able, over the course of those 20 minutes, to bring this person from mid-panic attack and with a loaded gun in hand to laughing with me and with the gun unloaded and put away in a safe, and a full safety plan for how the rest of their day would play out. And I think it's just a testament to how well this can work and how far you can go with someone who wants to be helped, just again by listening and being there and talking them through those moments. And for a lot of people, family and friends are huge buffers, and we'll sort of talk about those things. And for that call in particular, to know that that person's family was really close to having one of the worst days of their lives, and they have no idea how close they were to that being the day they had. And because this person was brave enough to reach out and ask for help, they're not having that day, is a really incredible thing to have gotten to play a part in.
So let's talk about strategies in the work setting. We talked a little bit about boundaries. This applies both your personal and your professional life. Establishing boundaries and having a clear understanding of your role and your needs to fulfill that role is very helpful. Taking a proactive approach to your wellness can really support increasing resiliency. This may mean setting some times for mini breaks or official lunch breaks, going outside, using your employee benefits such as vacation days or your EAP program. Creating a space for connection with your colleagues and using supervision as a time to build trust and resilience and skill building. What happens if you work from home? Well, if you work from home, try not to use your relaxing space to complete work tasks. Have an assigned area for work. We want to build boundaries for where we're going to unwind and where we're going to rejuvenate. How can we prepare ourselves to continue to sustain the work? Let's begin by emphasizing the importance of organizational support. I want to emphasize that it is not your responsibility to take this on, but rather it is a collective effort to voice up the need for trauma and resilience-informed organization. We can begin with that by doing what we're doing now in this video, by building community awareness and recognizing that dispatchers are first responders. We have to acknowledge that systemic and strategic change needs to take place to empower and equip our first responders with the tools that they need through policy change at a local and federal level. So our organizations, what can they do? Organizations can support staff by creating a culture of health and wellness with ongoing input and collaboration from staff. Creating a culture that empowers staff and training in professional development through guided protocols. For example, after action reviews, critical incident stress debriefing, implementation of intervention protocols, wellness accountability by assigning a wellness champion, ongoing supervision and peer support, ongoing organizational assessments and policies and practices. Self-awareness can provide us ongoing skill when we have activating events and utilize the practical interventions we discussed earlier in this video. Here are some areas that can build upon your social support. We can lean on our own self-empathy and compassion satisfaction, knowing that we are not always superheroes. We are human beings who need love, care, and community. Having an understanding that this may mean that you have some losses from time to time and that it is okay not to be okay. Here are some areas you can build upon with ongoing self-care. Self-care is an ongoing process and it's highly personal and will change from time to time. So please be open-minded to what you may need. Organizations can create a space of openness and transparency where staff can speak up when they want changes in policy, programs, and other areas that may be affecting their well-being. So what can you do to empower yourself and build resiliency? Well, we know that the work that you do is extremely valuable, and you want to be able to sustain this work in a healthy and meaningful way. And you can do this through increased self-awareness, social support, self-care, and purpose. Here are a few tips for self-awareness. Having self-awareness of our own beliefs through our reactions to experiences can provide an opportunity to take a proactive approach to our well-being. I want to acknowledge that the work that you all do does not waver. It does not waver in intensity and the highly stressful nature. I use the analogy of the wave. You know that the waves will continue to come, sometimes big and powerful, and sometimes they'll be small and manageable. But the waves will not stop. We also want to recognize that if you are suffering from vicarious trauma and burnout, it is not your fault. You have shown up every day and were present for the folks who needed it the most.
I became a crisis counselor for 988 because I have been on the other end of a suicide hotline, calling in for support for myself, and I've also lost a friend to suicide. So being a crisis counselor has given me a purpose for those events in my life, and it's allowed me to help other people.
I chose to be a 988 crisis counselor in the wake of the passing of one of my friends who died by suicide. After his death, I really wanted to get involved in the cause, really just kind of as a way to process my grief. And a year and a half later, I am now a full-time staff member, so that volunteering has turned into a career path, and I've never really looked back.
The reason I chose to be a 988 crisis counselor is because I really wanted to be someone that can be there for an individual who was in their darkest point in their life. I feel like when you're there to be a listening ear, it really can mean the difference between life and death in that moment.
What I would most like you to know about my role as a crisis counselor is that so many of the skills that we are taught to do, anybody can learn to do and to use them in their daily lives to help a person who's struggling. It's really less about knowing the perfect thing to say, and it's more about knowing what not to say. For example, when someone's opening up to you that they're struggling, don't immediately try to find a solution. And if they tell you that they're having thoughts about suicide, don't try to get them to not feel that way. Just give them space to communicate that they are feeling that way. I have a perfect visual to help you remember this. So imagine someone comes up to you and they tell you that they're struggling. If you say to them, "Oh, but you have so much to be grateful for, just look on the bright side." It's like someone is standing in the rain and they come up to you and they tell you that, and you say, "But it's so sunny out." You're denying their weather. Don't do that. Just stand beside them, open up an umbrella, listen, and let them talk.
What I'd like people to know about being a 98 crisis counselor is that I am not perfect, and I never have been, never will be. My goal is to feel like people have an outlet when they feel like they have no one. And I just try my best to be there for someone and use my skills and my training to do that, but also just my humanity, the fact that I want to know what's going on and be curious and give everything I can to help. That's all I've ever wanted to do in this job, and that's what I will continue doing. And I want to create a safe, non-judgmental space in order for people to share their darkest thoughts and their suicidal ideation, their emergency crisis situations, anything that they need to talk about. I want to be there. So